Hello and welcome to this YouTube video. Today we are discussing how to inject your medications. But first of all, I just want to apologize really quick for the lack of uploads. I've been very busy in my adult life with work and school and moving and such and so forth. But this video isn't for all that. This video is for injections. So I recorded this 6 months ago. Don't be surprised when you hear the difference in my voice. Alright? Hope we all enjoy.
Hello and welcome. My name is Caden Rayner. I'm 20 years old and I am a year and 6 months on testosterone. Today I will be teaching you, not only as a trans person, but also as an EMT, how to properly do your hormone replacement therapy shots. Personally, I started with my subcutaneous shots, and I swap my shot sites every 6 months. You will know what I mean. We will get to that in just a moment. But before we even get started, let's just go over some basics. Always have alcohol pads. Disinfect your shot site and your shot bottle, the medication bottle. Always disinfect it. It is important. If you don't do that, it can lead to problems in the future. You do not have to disinfect your needles. They are single use. Do not reuse needles. I don't care what the problem is. You can reuse your testosterone or estrogen bottles until they are almost empty and then call in for refill. But most of the time you're going to get 2 bottles of your hormones, a 48-day supply if you're anything like me. Alright, let's go over the sizes and angles for which to do your subcutaneous shots. I want to cover that. We are doing subcutaneous first. So, subcutaneous shots are done at a 45-degree angle. That is half of 90 degrees. Think of 90 degrees as straight up. 45 is either half of that to the right or half of that to the left, depending on which hand is your dominant hand. And here are your subcutaneous injection sites. Your stomach. I know. I understand. It can be spooky, but you are going to want to switch every one of these sites every time you do your shot. You're going to do your first shot in 1, 2, 3, 4, like swap every week or however often you do your shots, and then you're going to want to do the same thing. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. And then you start over until your 3-month mark. And then your 3-month mark, you're going to want to swap to intramuscular. But we don't have to talk about that right now. So, most of the time with subcutaneous shots, you're going to have a 1 milliliter needle. And by needle, I mean syringe. So, this part of the syringe, I'm going to be referring to as the barrel, because it makes sense to me. I don't know if that is technically what it's called, but the barrel. Okay. So, how to read your shot. Most of the time, the max dosage you're going to have until your first run of labs after you've been on your hormones is going to be 0.05. That is this number right here. Pretty self-explanatory. The 1 milliliter needle is something that you don't even have to think about, really. So 0.05, 0.04, 0.03, 0.02, and 0.01 if you're microdosing. With subcutaneous needles and shots, you're going to have a 1/2 of an inch up to 3/4 of an inch needle, or if you're on the more chubby, heavy set side, you might want a full inch needle. Just don't stick it in all the way. Make sure that you are injecting the needle slowly into your skin and inject your hormones slowly as well. You can have a reaction if you don't. I think that's everything that I want to cover before we actually watch the demonstration. So let's go over the demonstration. This is my alcohol pad. This is my testosterone bottle. I disinfect the top of the bottle for roughly 10 seconds. I dropped it. Since it did land on a clean counter, I was fine with reusing it, but you really shouldn't do that. So, take off the top of your needle. Keep it And as you can see, this is a 1 milliliter needle syringe. This is a 1/2 inch needle itself. It is a 27 gauge needle. You're gonna want to be using 24 to 27 for subcutaneous. It can be a smaller needle. Push air in your medication bottle before extracting the medication. Why? That medication inside that bottle is a vacuum. If you fuck up the vacuum inside that bottle, you are going to fuck up your dosage and the medication itself. You need to keep that vacuum. So if your dose is 0.4, like mine used to be, my dose now is 0.3. So if your dose is 0.4, you're going to want to pull 0.4 milliliters of pure air into your syringe, and then push that needle into your bottle. Push the air into the bottle, flip the bottle upside down to better drain out the medication, and pull 0.4 milliliters of testosterone or estrogen into your syringe. That is how it is done. If you do not do that, you will fuck up your entire bottle of testosterone or estrogen. So please do that. Make sure you do that. So I cut the video there, and then here is me doing the actual shot. My needle, as you can see, is a 45-degree angle into my stomach. I had already pushed the medication into my stomach, and I always keep my alcohol pad around to put exactly on the spot of injection. Keep your cap around so that you can cap off your needle. Put it in a needle disposable chamber, or like a vinegar bottle or something. I don't know, just as long as... Look up your state's laws on how to dispose of needles. Personally, my state doesn't have too strict of laws. Just as long as it is in a closed container, they do not care. So, you know. I always put a band-aid on to remember where I did my shot so that I don't do it in the same spot, because like I said, you should be cycling these locations. 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. And then you start over until your 6 month, preferably 3 month mark. Always put your band-aid on to remember where you did your shot, and then you're good to go. That's all there is to it. It's just a matter of sucking up, being tough. Alright, let's move on to intramuscular injections. Intramuscular injections are done with 3 milliliter syringes most of the time. With 3 milliliter syringes, they are a little bit more complicated to read. Hold, we're gonna find it better. There we go. So, 3 milliliter syringes are a little bit more difficult to read. This is 0.1 milliliters. 0.2, 0.3, 0.4, 0.5 is 1/2 of a milliliter. 0.6, 0.7, 0.8, 0.9, 0.10 is equivalent to 1 milliliter. That's often going to be the one that you find with a thicker needle, which is a lower number. Higher the number, smaller the size. For intramuscular injections, your needle size is going to be 21 gauge to 25 gauge. So most of the time people settle on 23, which is totally fine. It's healthy. And your syringe, your actual needle, is going to be 1 inch to 1.5 inches long, depending on your body type. So if you're on the skinnier side, such as I am, I only need 1 inch. Technically, I only need 3/4 of an inch, but I still get 1 inch because it's harder to find 3/4 of an inch and 23 gauge than 1 inch and 23 gauges. So intramuscular injection sites are your legs. That's it. Like, you could do your arms, but you would need assistance from another person. So we're just operating under the assumption that you don't have anybody. But, you know, you're going to do 1 shot here, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, and then keep rotating until your 3 month mark. Yet again, always wash your hands. Always disinfect the top of your hormone replacement therapy bottle. I think that's everything. It's done at a 90-degree angle instead of a 45, though. It has to get deeper inside of your skin. Alright, here is my representation. Here's my testosterone bottle. Here's my alcohol pad. Always keep your alcohol pads. Do not reuse them after one usage step. Like, throw them away just with your needles. But don't throw needles into the trash without the top, which I always keep to the side. As you can see, this is a 3 milliliter syringe. I'm pulling out a little bit more air, pushing it into the bottle, as you should always do, no matter what medication you are pulling from. Even with insulin, it is a vacuum. Do not fuck up your vacuum. If you fuck up your vacuum, you fuck up your medication. Cool. Now, here's me doing the actual shot. So this is going to look like it's the incorrect angle, but I promise you it is not. You are not going to want to do your intramuscular shots on the top of your leg. You're going to want to do them to the side. So since I'm right-handed, it's going to look like a 45-degree angle to the left, but I promise you, just look at how I'm injecting it. I am doing it 90 degrees into that part of my leg. If I were to rotate my body a little bit, you would be able to tell that that needle is sticking straight out of my leg. So, this is correct. Inject your medication slowly. Push a little bit more. Specifically on 3 milliliter syringes, the medication is harder to get out. So, you're going to want to push extra hard on that. But, like, don't... That's why you always need 2 hands to do an injection. You're going to want to push your medication out. Always cap off your fucking needles. Please cap off your needles. If you don't, that is a danger to yourself and others. Always put on your band-aid so that you remember where you did your shot, so that you don't do it in the same spot next time. This is beautiful. This is a wonderful video. Great. And then you're done. Just suck it up, buttercup. You'll be fine. You might be sore for a little bit. Couple of days. That's it. Hope y'all enjoyed. Hope y'all learned something. And be safe out there. Listen to your body. If you have any reactions or problems with your medication, tell your provider immediately, because any medication can kill you. So just please be careful. Alright. Peace out, y'all.